So clonidine was first approved for medical use in the United States in 1966, and by 2018, it was the 75th most commonly prescribed medication in the United States, with more than 11 million prescriptions. Welcome back, Straight Talkers. Today I'm going to talk about the medication clonidine so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. It's important to recognize that each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So clonidine is the generic name, and Catapres or Kapvay are the brand names. The generic medication has the same chemical formula, but it may or may not be exactly the same strength as a brand name medication. Also, some of the brand medications might contain various dyes or other components that can cause allergic reactions. So it's always a good idea to talk to your doctor or pharmacist about whether or not it's important for you in particular to use the generic or the brand version of the medication that you're being prescribed. So how does this medication work? Clonidine is considered to be an alpha agonist, and it affects the levels of the neurotransmitter norepinephrine, which then works to decrease levels of excitement in certain parts of the brain. This medication is not a stimulant, like the methylphenidate or amphetamine products, so it carries no abuse potential. In adults, clonidine is FDA approved for the treatment of ADHD and hypertension. It's also approved for the treatment of ADHD in children 6 and older, and it's used off-label at times for the treatment of conduct disorder, oppositional defiant disorder, motor and vocal tics, PTSD, aggression, anxiety, panic disorder, sleep difficulties, migraine prophylaxis, and opioid withdrawal. Clonidine comes in short-acting tablets, long-acting tablets, and a skin patch. And the patch formulation is generally not used outside of the treatment of hypertension because the effects on blood pressure might be prolonged and continue even after the patch is removed. Dosing is generally between 0.5 milligrams and 0.4 milligrams daily, with the short-acting form being taken 3 times per day and the long-acting form typically taken only once or twice per day. If I'm using this medication in kids, my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Once this medication is started, it usually takes a couple weeks before you start noticing a difference, and in many people it'll take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. And because of this delay, I often recommend starting therapy during this time because the benefits of therapy can be seen right away. And the goal of treatment with this medication is complete remission of current symptoms, as well as the prevention of future episodes. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Some side effects are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change in the dose. But what we typically see is that these side effects will go away with time as your body gets adjusted to the medication. The common but usually more mild side effects of clonidine can include things such as headaches, abdominal pain, constipation, upper respiratory tract infections, irritability, sore throat, nausea, dizziness, increased body temperature, ear pain, and somnolence or fatigue. Clonidine is generally more sedating than guanfacine, and this is typically worse in the first 2 to 4 weeks and gradually improves with time. However, there are some kids that will have this persist depending on how sensitive they are to the medication. More serious but less common side effects could include low blood pressure, confusion, bedwetting, fainting, irregular heartbeat, or kidney damage. If you or your child are experiencing any of these side effects or any others that weren't discussed, please talk to your physician so that they can work with you on determining the appropriate next step of action. It's also important to realize that taking multiple medications at the same time might cause one medication not to work as well or lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and definitely make sure that your doctor has an up-to-date list of all the medications that you're taking. And this not only includes those that are prescribed to you, but also the ones that are bought over the counter or on the internet. The amount of time someone will need to be on this medication varies from person to person. Often in kids, the patient, the parents, the doctor, and the school will work together to determine what is right for each patient. When deciding to come off of clonidine, please do not stop taking this medication without talking to your physician first. It's important not to stop this medication suddenly, and I cannot stress this enough, because doing so can cause one's blood pressure to increase, and this is true even if it was normal before starting the medication. This is called rebound hypertension, and it typically occurs 2 to 4 days after abruptly stopping it. My approach is always to gradually reduce the dose. In addition to helping prevent blood pressure fluctuations, decreasing the dose slowly will also help prevent unwanted withdrawal symptoms such as headaches, irregular heartbeats, chest pain, stomach aches, trouble sleeping, lightheadedness, worsening behavioral problems, and increased anxiety. Make sure to let your physician know if these symptoms or any others start to occur when you try to come off of the medication, because there's different approaches that we can take to help reduce these unwanted effects. Now head on over to the next video to find out more ways that you can help your child live their best life.